Welcome to the emergency departments at Brampton Civic Hospital and Etobicoke General Hospital, two of the busiest in Ontario. Despite treating high patient volumes, both have amongst the highest patient satisfaction rates in the province within large community hospitals. Here, our doctors and staff treat more than 600 people arriving by ambulance or car every day. Open 24 hours a day, 365 days a year, the emergency department is the right place to come if you have a serious injury or condition. Here are a few of the many reasons why you might visit the emergency department. Chest pain or abdominal pain, shortness of breath, dizziness or fainting, internal bleeding, numbness or weakness in arms or hands, major trauma, mental health issues, fever in infants 3 months and younger, overdose or poisoning, pregnancy-related emergencies, seizures, stroke symptoms, or any serious condition you feel is getting worse. Remember, if you have severe chest pain, stroke symptoms, or aren't sure how serious your condition is, always call 911 or go to your nearest emergency department. Here are some tips to help you understand what to expect when you visit an Osler emergency department. The emergency department does not see patients on a first-come, first-served basis. While that system might work well at the seafood counter in your local grocery store, it doesn't work well in an emergency department, where doctors and staff are often treating people with serious and life-threatening conditions. To help us treat people with the most serious illnesses and injuries first, we use a system called triage. Every patient is seen by a specially trained nurse, whose role is to assess the seriousness of each person's condition and prioritize the order in which patients will be seen. A patient who arrives in the emergency department after you may be seen first because their medical condition is considered more serious. We will do our best to make sure you see a doctor as soon as possible. If your condition changes while you are waiting, please let the emergency staff know. How long you spend in the emergency department will depend on a number of factors beyond how many other people are seeking care. You may need to have some tests to help the doctor make a diagnosis. This could include blood work, an X-ray, a CT scan, or an MRI. The doctor will need to wait until the results of your tests are back before making a diagnosis and planning your treatment. If you have been given a medication, you may need to remain in the emergency for a while for observation. If the doctor feels you need to see a specialist or you need to be admitted to hospital, this may also add to your time in the department. Once the doctor has diagnosed your condition and planned a course of treatment, you may be discharged with some follow-up instructions, or you may be admitted to hospital for further care. There is a seamless transfer of your emergency visit record to your family doctor upon discharge. Make sure you ask questions about your follow-up instructions before you leave. Osler's doctors and staff are caring professionals who work tirelessly to make sure every patient is seen and treated, even during the busier-than-normal holiday and flu seasons when the time you spend in the emergency department may be longer. At Osler, we are always working to help reduce how long patients are in the emergency department and to respond to what we're hearing from patients through our surveys. Here are some of the actions we have taken to date. We opened an urgent care center at Peel Memorial to treat non-life-threatening injuries and illnesses. We added more doctors and staff during the busiest times of day. We set up dedicated patient zones and teams for critically ill patients, children, heart patients, people with mental health issues, and for those with non-life-threatening illnesses. We coordinate extra help at home for discharged seniors, and we provide registration support for people returning for next-day diagnostic appointments. Exciting changes are on the horizon at Etobicoke General, where a new emergency department, 3 times the size of the existing department, is slated to open in early 2019. We are continually looking for new ways to improve the time it takes for a patient to see a doctor. Etobicoke General has amongst the lowest physician initial assessment wait times in the province, while Brampton Civic wait times continue to show improvement. At Osler, we are committed to ensuring the delivery of timely, safe, and compassionate emergency care to patients and families all across our communities. For more information about emergency care at Osler, please visit our website at www.williamoslerhs.ca.